science behind weight changes at menopause, and I'm quite happy to talk about it because at menopause, so many things happen to a woman that she's left quite. She and the healthcare provider also are left quite perplexed with as to what is happening and what can be attributed to menopause itself, what can be attributed to aging, and how to combat that. Next, please. Next, please.
Yes, again, it's not working.
Oh, yeah. So we have lots of literature to show that there are changes in weight, not so beneficial ones. There are changes in waist circumference in middle aged women, especially around the time of menopause. And that said, there are also specific studies that have looked into what is this weight gain around menopause, why is it happening, is it because of physical activity changes, or what kind of diets are impacting it. So we have tons of literature around this aspect. Next, please. And by and large, it is noted that at least 75% of the women are reporting this kind of weight gain during the perimenopause period. Say 1 in 4 women complain of overweight, or 2 in 5 complain of obesity, and overall it's 2 out of 3 who are either overweight or obese. And this excess adiposity is definitely hurting them. So this obesity, and particularly the increase in the waist circumference, or the deposition of central obesity or visceral fat, are the major risk factors. And during midlife, they do bring about metabolic and even cardiovascular changes. And to add to it, they are going through menopause and all the symptoms around it. One of the first manifestations, or one of the most important manifestations of this excess adiposity, is cardiovascular disease. And that becomes the leading cause of death. It's not cancer, it's not anything else, but it's cardiovascular disease in women around menopause that are losing their lives. Next, please. And some of the other aspects, metabolic changes that are attributed to this excessive weight gain during menopause, uh, is are also listed here. Amongst them is hypertension. Every 4.5 kilogram increased weight during early midlife leads to increased risk of hypertension by at least 30%. That's quite a significant gain. Also, dyslipidemia. Type 2 diabetes incidence is 37% in midlife women. Dysglycemia, sorry. And women with incident diabetes have a higher BMI at baseline. There's also dyslipidemia. Elevated BMI during this midlife leads to increase in the total cholesterol, LDL cholesterol, ApoA, ApoB. All are independent markers of cardiovascular disease as well. And then you have also the manifestation in the form of metabolic dysfunction associated steatotic liver disease, which is the leading cause of chronic hepatic disease, cirrhosis, and even liver cancer. It becomes a leading indicator for liver transplant in women as well. And last but not the least, one of the most fatal ones is cancer. Every 5 kilogram increase in weight leads to an increased risk of, say, endometrial cancer by 39%, breast cancer 20%, ovarian cancer by 13%, even colorectal cancer by 4%. So you see, these women at menopause are vulnerable to so many of these metabolic and cardiovascular disease manifestations, and that indeed is responsible for increased death or earlier death in this population. Next, please. So, is menopausal weight gain real? I mean, we really need to ask that: is it something where it's a figment of our imagination, or is it really happening? Midlife females gain an average of zero point 0.4 to zero point 0.7 kilograms per year. And of course, there is chronological aging. Aging itself is a big risk factor for weight gain in midlife women, but it's not just related or limited to midlife. But we have seen that obesity prevalence among adults over 40 years rises by 11%. So, whether you've been overweight in your earlier life, in your young adulthood, or not, you will still end up gaining some weight as you cross or as you enter mid age. And as compared to 20 to 39 years in both sexes, there is a massive increase in obesity, almost 11% increase when you touch the 40s. So I think in that case, it's a milestone birthday in every person's life. Next, please. Yes, and these are all the changes that are happening simultaneously, right? The woman is not only aging, but she's also going to go through menopause. There's just no two ways about it. So, the aging and the associated behavioral changes bring about definitely increased fat mass, like I just showed you all the evidence. But there's also a decrease in the muscle mass, which is hurting much more, and that decreases the resting energy expenditure. Simultaneously, increase in caloric intake or increase in abnormal or non-balanced diet intake, and reduction in physical activity will also lead to decreased activity related energy expenditure, and both result in weight gain. Simultaneously, there are hormonal changes, right? At menopause, we know that the estrogen is declining, and that itself is associated with increased visceral fat, and that leads to the visceral obesity. And together, they are really, really harmful, because not only there is weight gain, but there's also increase in that visceral fat adiposity around the waist. Next, please. Now we tend to wonder if it's only happening in women or also in the men. So if we compare women between 18 to 45 years as compared to men between 18 to 45 years, you can see that the BMI increase in women is 0.16 per year, and percentage body fat is zero point 0.4 per year. But if you compare the men in the same age status, you can see that the weight, the BMI gain, as well as the body fat percentage is far more in the men. Now you take the same women in 45 to 65 years of age, where the BMI increase is 0.18 per year and the body fat percentage increase is zero point 0.5 per year. Look at the corresponding BMI and body fat percentage increase in men in the last block between 45 to 65 years. It's much lesser compared to women. So yes, there is a difference in the sexes, and that impacts the body weight and adipose accumulation in the body. Now, if you look at it, menopause is again significantly impacting the body fat distribution. It's not just the weight gain and the central adiposity, but it's also the redistribution. So, if you look at premenopause in terms of fat mass and fat mass proportion, you can see at menopause transition how dramatically it does increase. There is a 1% fat proportion increase every year, which can be quite significant for some. And what is harming us more is the lean mass decrease. So, if you see premenopause, the loss in lean mass, and you can see that it almost doubles or triples in terms of when the woman is menopausing, and the shift to the gynoid adiposity and the shift to a harmful, more harmful type of fat distribution definitely occurs post menopause. So all this data is just to corroborate the fact that we are claiming menopause and aging both simultaneously hit the woman in her midlife, causing that abnormal fat gain or dysfunctional adipose tissue. Again, to actually give you a more detailed perspective, the increase in this fat mass and the simultaneous decrease in the lean mass are more precipitous 2 years preceding and 2 years after the cessation of menses, which is menopause indeed. So that those 2 years before and after are the most critical in terms of losing that muscle mass and increase in the fat mass. And why am I telling you this? Just so that we keep in mind that menopause significantly influences body fat redistribution and we can do something about it. Next, please. The mechanisms involved in weight gain during midlife, if I have to summarize them in one slide, then it would be loss of lean mass, the physical activity reduction, the reduction in the fat oxidation itself, the dietary changes, the vasomotor symptoms that are associated with the hormonal shift during menopause, and the sleep disturbances with that come with aging, as well as the changes in the hormones. Now we quickly go through them, each of them. Next, please. So the lean muscle mass, which is going down, well, there is decreased muscle protein synthesis itself, which causes the muscular cell to atrophy, and that over time will reduce the muscle mass itself. All this starts in midlife with 1% decrease in muscle mass every year, such that by the time she is 80, there's almost a 50% reduction in her muscle mass. See how sarcopenic we would be. Next, please. And all this change in the muscle protein dynamics itself is caused by decreased protein intake, reduction in physical activity, and because of the lean mass loss, there is fat infiltration in the muscle as well. That causes for the inflammation, and there is impaired amino acid sensing as well. So all this muscle protein, which is well balanced throughout life, it goes for a complete toss, and there is a marked imbalance in the same. Next, please. And how do the hormones make it worse as well? We saw the impact of aging on the uh, lean mass. But throughout a woman's life, it's the estrogen that binds to the receptor and decreases the oxidative stress, enhances muscle regeneration, maintains the satellite cells for muscle repair. And over time, when you see the estrogen is declining with the onset of menopause, there's protein degradation. There is dysfunction in the satellite cells, which does not allow the muscles to be repaired in time. There is also associated inflammation, and all this is causing the disharmony at the muscular level. But even phytoestrogens can promote protein synthesis and enhance myoblast differentiation. Next, please. So overall, there is lean muscle loss with aging, which is intensified by menopause, and that itself results in reduced energy expenditure, affecting the resting metabolic rate, which declines 2 to 3% after we age over 50. Next, please. The next thing is the change in the physical activity. We know that at least 150 minutes of moderate intensity or 75 minutes of intense aerobic plus strength training activities twice per week are the recommendations. This is only in 1 week. However, we've seen that even studies have shown that 34% of adults in the US reported insufficient physical activity, with females exhibiting even higher rates of physical inactivity as compared to males. 43% versus 29%. This is just from one study, right? But we know the critical role that physical activity can play in maintaining muscles as well as your overall health. So the trend is that with increasing age, only 7.2% of midlife women actually met the exercise recommendations that are given for them. Next, please. Now we know that during menopausal transition, proportion of women meeting this exercise recommendations actually decreases dramatically by 40%. There is also decreased duration of moderate to vigorous physical activity that decreases by 35%. And physical activity related energy expenditure also overall goes down because of all these aspects that I already talked to you about. So there is a 95% cumulative decline in total energy expenditure because of these changes in physical activity. Next, please. Now you can see the hormonal changes as well. Over this transition from premenopause to menopause, there's a 33% reduction in the 24-hour and the exercise related fat oxidation itself. Estrogen increases fat oxidation. I just told you about two to three slides ago. But menopause, which is related with decrease in estrogen, is a state where there is reduced fat oxidation, there is influencing of substrate utilization during exercise because of this, and there is increase in the deposition of visceral fat mass. So these changes in fatty fat oxidation also affect us very badly. Energy intake and dietary habits also significantly, uh, actually they are not significant contributors, but we know that in the Indian women they are. During menopause, despite of increase in appetite, there is decrease in the total energy intake. But also there is decreased protein consumption. Only three-fourth postmenopausal women meeting the recommended protein intake. And I'm telling you that this is much, much worse in India. So there's decrease in satiety, there is increased hunger, but again, the protein intake is low because the overall intake is less, and higher body fat and fat to lean ratio is what we achieve with this kind of uh, inconsistent dietary intake. How do the vasomotor symptoms affect the weight gain during menopause? Well, they actually impact 80% of the females during and after the menopausal transition. And it has been noted in several studies that when there are vasomotor symptoms over time, so over, say, for example, 10 years, there is increase in weight, the significant increase in the BMI, and increase in the waist circumference as well. And we also know that vasomotor symptoms by themselves cause sleep disturbances, which is an independent risk factor for weight gain. Sleep disturbances increase during menopause. Well, premenopause, if it is 31%, during menopause, it increases to more than 40% of women complaining of sleep disturbances. And for example, during menopause, it's more awakening during the sleep. And post menopause, there are just difficulties falling asleep itself. And half the women, I'm sure it's much more than what these studies have shown us. Next, please. Next, please. So, overall, we know that less than 5 hours of sleep is associated with a 32% increase risk of gaining over 15 kilos in 16 years, independent of the baseline. So, encourage even your young adults and mid adults to start sleeping more and adequately. Disruption of the circadian rhythm again leads to changes in the hunger hormones with increase in ghrelin and decreased leptin. Again, sleep deprivation leads to increased energy expenditure by 100 kilocalories per day. But simultaneously, it also increases the energy intake more than 250 kilocalories on an average. So there is net uh, loss in adequate metabolic health, and there is weight gain. Next, please. Thus, we know that the entire estrogen story, or in terms of the menopause associated with estrogen decrease, impacts us badly because we need estrogen for preserving the muscle homeostasis, for the cardioprotective effects, for regulating the hepatic function, for promoting vasodilatation, for modulating glucose and lipid metabolism. For it, I'm done. It also is responsible for the gynoid fat distribution, and it exerts ventilatory control. This is the central role of estrogen, which we are losing out at menopause. Next, please. So, overall, this triple whammy of, say, menopause, aging, and weight gain, all these three happening together are a disaster for your metabolic health, because glucose metabolism is affected, lipid metabolism is affected. The liver function goes for a toss with increase in mast cell. There is also increase in the obstructive sleep apnea prevalence. There's increase in hypertension prevalence and the vasomotor symptoms that by themselves cause weight gain as well as sleep disturbances. Next. So, the weight gain prevention, management of menopause symptoms, and evidence based treatment of obesity is the key. Next, please. So, preventing weight gain, I think this audience knows very well that dietary changes, behavioral modification, physical activity, underlying anything and everything that we can offer pharmacologically. Next, please. So, it definitely needs to align with the pharmacological as well as surgical options that we can provide to our patients. Next. Again, I've already told you diet, exercise, and physical activity behavior all impact, along with good pharmacotherapy options that we have today, can help us deal with this weight gain during menopause. And this is a slide that just summarizes the entire talk. Thank you so much for a patient hearing and this opportunity.